The shoulder is a complex joint with remarkable mobility. It allows for a wide range of movements, including lifting, rotating, and reaching in various directions. This flexibility is due to its unique structure, which includes bones, muscles, tendons, and ligaments working together harmoniously. This wide range of motion, however, makes it susceptible to various injuries and conditions. Common issues include dislocations, fractures, and soft tissue injuries such as tendinitis and bursitis. These conditions can significantly impact a person's daily activities and quality of life. A thorough clinical evaluation is crucial for healthcare providers to accurately diagnose and treat shoulder problems. This involves a detailed patient history, physical examination, and often imaging studies. Understanding the patient's symptoms and how they affect their function is key to forming an accurate diagnosis. This essay will delve into the intricacies of diagnosing common shoulder conditions, specifically subacromial impingement and rotator cuff pathologies. These conditions are prevalent and can cause significant pain and disability if not properly managed. We will outline a series of diagnostic tests, explaining their procedures and clinical significance. These tests include physical maneuvers to assess range of motion, strength, and stability, as well as imaging techniques like X-rays, ultrasounds, and MRIs. These tests aid in understanding the underlying cause of shoulder pain and dysfunction. By pinpointing the exact nature of the problem, healthcare providers can tailor their treatment approach to the individual needs of the patient. This knowledge is essential for developing an effective treatment plan. Treatment may include physical therapy, medications, injections, or even surgery in severe cases. A well-rounded approach ensures the best possible outcomes for patients, helping them return to their normal activities and improve their quality of life. Two of the most prevalent shoulder issues are subacromial impingement and rotator cuff tears. These conditions are common among athletes, manual laborers, and even those who engage in repetitive overhead activities. Subacromial impingement occurs when tendons and soft tissues get compressed in the space between the shoulder blade, or acromion, and the upper arm bone, or humerus. This compression can be due to various factors such as bone spurs, inflammation, or repetitive motion. This impingement can lead to pain, inflammation, and limited range of motion. Patients often experience discomfort when lifting their arms or performing activities that require shoulder movement. Rotator cuff tears involve damage to the group of muscles and tendons that surround the shoulder joint. These muscles and tendons are crucial for stabilizing the shoulder and allowing a wide range of movements. These tears can range in severity from minor strains to complete ruptures, and they can occur suddenly due to an injury or gradually over time due to wear and tear, causing pain, weakness, and difficulty with arm movement. Treatment options vary depending on the severity of the tear and may include physical therapy, medication, or even surgery in severe cases. Early diagnosis and intervention are key to managing these conditions effectively and preventing further damage. Neer's test is a common examination technique used to identify subacromial impingement. To perform this test, the examiner stands behind the patient. The examiner stabilizes the patient's shoulder blade with one hand. With the other hand, the examiner passively raises the patient's arm forward. The arm is internally rotated, meaning the thumb points downward. If the patient experiences pain during this maneuver, it suggests a positive Neer's test, indicating potential subacromial impingement. Hawkins' test is another valuable tool for assessing subacromial impingement. In this test, the patient's arm is elevated to 90 degrees forward. The examiner then internally rotates the arm, bringing the patient's hand toward the opposite shoulder. This maneuver compresses the tissues in the subacromial space. If the patient feels pain, it suggests a positive Hawkins test, further supporting the possibility of impingement. Section 5. The drop arm test. Assessing rotator cuff tears. The drop arm test helps evaluate the integrity of the rotator cuff muscles, particularly the supraspinatus. The examiner passively abducts the patient's arm to 90 degrees, positioning it parallel to the floor. The patient is then asked to slowly lower their arm. Inability to control the descent of the arm or sudden dropping of the arm suggests a positive drop arm test. This finding often indicates a tear in the supraspinatus muscle or other rotator cuff muscles. Section 6. The belly press test. Another look at rotator cuff function. The belly press test, also known as the Napoleon test, further assesses rotator cuff function, specifically the subscapularis muscle. The patient places their hand on their abdomen with the elbow flexed. The examiner then applies resistance as the patient attempts to press their hand into their belly. Weakness or inability to maintain pressure against resistance suggests a positive belly press test, indicating potential subscapularis weakness or a tear. Section 7. The lift-off test. Isolating subscapularis function. The lift-off test specifically targets the subscapularis muscle's function. The patient places their hand behind their back at waist level, with the back of their hand touching their lower back. The patient is then asked to lift their hand away from their back. Difficulty or inability to lift the hand off the back suggests a positive lift-off test, indicating potential weakness or dysfunction of the subscapularis muscle. Section 8. Adduction, external rotation test. Evaluating infraspinatus and teres minor. The adduction/external rotation test assesses the function of the infraspinatus and teres minor muscles, both important rotator cuff muscles. The patient's arm is adducted to their side with the elbow flexed to 90 degrees. The examiner then applies resistance as the patient attempts to externally rotate their arm outward. Weakness or inability to resist the examiner's force suggests dysfunction or weakness in the infraspinatus and/or teres minor muscles. Section 9. The Job test, also called the empty can test, specifically targets the supraspinatus muscle, a common site of rotator cuff tears. The patient elevates their arms to shoulder level with their elbows extended and thumbs pointing downward as if emptying a can. The examiner applies downward pressure while the patient resists. Pain or weakness during this maneuver, particularly compared to the opposite side, suggests a positive Job test. This finding often indicates a tear or tendinitis in the supraspinatus tendon. Section 10. Conclusion. Seeking expert diagnosis and treatment. Shoulder pain is a common complaint, and accurate diagnosis is crucial for effective treatment. Many individuals suffer from shoulder pain due to various reasons, including injuries, overuse, or underlying medical conditions. Identifying the root cause of the pain is the first step towards effective management and relief. The tests described in this essay provide valuable information about the integrity of the rotator cuff muscles and the presence of subacromial impingement. These tests, such as the NEAR test, Hawkins-Kennedy test, and the empty can test, help in pinpointing specific issues within the shoulder structure. They are essential tools in the hands of healthcare professionals to assess the extent of the injury or condition. However, it's important to remember that these tests are just one part of a comprehensive shoulder evaluation. A holistic approach is necessary to understand the full scope of the problem. This includes considering the patient's overall health, lifestyle, and any other symptoms they may be experiencing. A thorough medical history, physical examination, and imaging studies, such as X-rays or MRI, are often necessary for a definitive diagnosis. These imaging techniques provide a detailed view of the shoulder's internal structures, helping to identify issues that may not be apparent through physical examination alone. They can reveal conditions like fractures, dislocations, or soft tissue damage. If you are experiencing shoulder pain or dysfunction, it is essential to consult a qualified healthcare professional. Early intervention can prevent the condition from worsening and improve the chances of a full recovery. A specialist can guide you through the process, ensuring that you receive the most appropriate care for your situation. They can perform a comprehensive evaluation, order appropriate tests, and develop an individualized treatment plan tailored to your specific needs. This plan may include physical therapy, medication, lifestyle modifications, or even surgical options if necessary. The goal is to restore function, reduce pain, and improve your quality of life.